Good evening. My topic is about disorders of conjunctiva. That is, three topics: conjunctivitis or pink eye, keratoconjunctivitis SICCA or dry eye syndrome, and conjunctival bleeding. These are the three topics which I am going to discuss about today. So here first topic is conjunctivitis or pink eye. Conjunctivitis or pink eye is the inflammation of the clear membrane covering the white part of your eye, that is the conjunctiva. Common symptoms include redness, itching, burning, discharge. Thick and sticky for bacteria, watery for viruses and allergies. It is typically treated with antibiotic drops for bacteria, antihistamines for allergies, for supportive care for viruses. Conjunctivitis is commonly known as pink eye. It's the inflammation of the conjunctiva, the transparent membrane which covering the white part of your eye and the inner eyelids. It causes the blood vessels to swell, resulting in a distinct pink or red appearance. The conjunctiva is the clear membrane that covers the part of your eye and the inside of your eyelid. The medical name for pink eye is conjunctivitis. It is extremely common. It can affect one eye or both eyes at the same time. Pink eye can be a short, acute or long term. That is chronic. Acute pink eye lasts for fewer than 4 weeks. Chronic pink lasts for more than 4 weeks. There are different types of conjunctivitis. You can see the bacterial conjunctivitis. Bacterial conjunctivitis is caused by the bacterial infections like Staphylococcus, often protruding or producing a thick yellowish green discharge that can cause the eyelids to crust and stick together in the morning. Then viral conjunctivitis is often caused by the same viruses that cause the common cold. It leads to watery discharge and typically it spreads easily. Then allergic conjunctivitis, it is triggered by allergens like pollens or pet danders. It involves the intense itching, tearing and usually affects both eyes. This type is not contagious. So there are three types of conjunctivitis. We'll see the causes. What are the causes of conjunctivitis? Conjunctivitis is generally classified into three main types, which dictates how it is treated. So infectious, viral or bacterial, that is highly contagious and easily spread through contact or respiratory droplets. Viral cases often accompany cold-like symptoms, while bacterial cases feature thick discharge. Allergic, it is caused by triggers like pollen or pet danders. It is contagious and usually affects both eyes with intense itching. Irritant conjunctivitis results from exposure to foreign substances like smoke, swimming pool chlorine, or loose eyelashes. We can see the causes according to some disease conditions that will lead to this conjunctivitis: chlamydia and gonorrhea, tuberculosis, ocular tuberculosis, mumps, measles and influenza, Lyme disease, mycosis, that is the infection caused by the fungus, sarcoidosis and the crab lice. You can see the pathophysiology. Pathophysiology, you can see the microbes enter the eye on contact with infected objects. Inflammation of the eye occurs, dilatation of the blood vessels of the eye and swelling, redness, exudate and discharge. So here you can see the picture of the symptoms of conjunctivitis. You can see the redness in the white of the eye, that is the conjunctiva, watery eyes, thick yellow discharge from the eyes, burning of the eye, itchy eye, swollen eye. So these are the typical features of conjunctivitis: redness and swelling in bacterial and viral conjunctivitis. Opaque discharge in bacterial, and clear tearing in viral, crusting in bacterial, and follicles or bumps on the inner part of the eyelid in viral conjunctivitis. So the diagnostic evaluations or investigations are, we can do allergy testing, visual acuity test by Snellen chart, fluorescein eye stain, examination of the eye discharge sample analysis, eye culture test. These are the diagnostic evaluations. Treatment: clean your eyelids safely, stop using contacts and makeup, avoid wearing contact lenses until the infection is completely cleared. Practice strict hygiene, especially wash your hands frequently with warm soapy water. Never share your pillows or towels or eye drops with anyone. Manage the allergies, whatever allergy you have. So if the conjunctivitis is caused by allergies, we will be having intense itching. So avoid the triggers and the OTC antihistamine eye drops. Then medications, you can give antibiotics for bacterial, antivirals for viral, antihistamines and corticosteroids if allergies are there. Symptom relief by applying cool compress to reduce itching and swelling, warm compress to soften the crusty purulent discharge. Use the artificial tears to lubricate the irritant eyes. Eye hygiene, gently clean the eyelids from the inner to the outer canthus using a fresh damp cotton ball or tissue for each wipe to avoid cross contamination. Then eye protection, advise the patient to wear sunglasses outdoors to reduce the photophobia or light sensitivity. Then we can see the complications. Corneal and visual complications are there. That is corneal and visual complications: keratitis, that is inflammation of the cornea, corneal ulcers, dry eye disease and scarlet. Then systemic and other infections are orbital cellulitis, septicemia or meningitis. In rare cases, complications are permanent vision loss or blindness. Nursing diagnosis: acute pain or impaired comfort related to ocular inflammation, swelling and crusting. Risk for infection related to contagious nature of bacterial or viral agents and the potential for cross contamination. Deficient knowledge related to disease transmission, proper medication administration and hygienic practices. The outcomes: the patient will remain free of cross contamination to the unaffected eye. Patient will report reduced eye pain and verbalize comfort. The patient and the caregiver will currently demonstrate eye drop administration and hygiene practices. So the nursing interventions: eye hygiene, compresses, apply cool or warm compresses. Medication administration as per the description or the prescription: topical antibiotics, antivirals or antihistamines, contact lenses. Instruct to wear, strictly discontinue the wearing of contact lens until the eye is clear. Then coming to patient education: hand hygiene, contact lens, avoiding that, stop wearing contact lens, and reusable lenses must be professionally or thoroughly disinfected before reuse. Contamination prevention by preventing the sharing of eye drops, towels, pillows or cosmetics, and patient must not rub their eyes, and discard and replace all eye makeup. Then isolation precautions: advise the patient to stay home from school or work for at least 24 hours after starting the antibiotics or until active. Contagious symptoms has to be resolved, like eye discharges have to be resolved. Next topic is keratoconjunctivitis SICCA, KCS. That is also known as dry eye syndrome. It's commonly known as dry eye syndrome. It's a chronic condition where the eyes fail to produce tears, or tears evaporate too quickly. They fail to produce enough tears, leading to inflammation and irritation. It is characterized by burning, a gritty or foreign body sensation. sensitivity to light, and sometimes fluctuating blurred vision. So the definition is KCS or keratoconjunctivitis SICCA is commonly known as dry eye syndrome. It's a multifactorial condition characterized by inflammation and dryness of the cornea and the conjunctiva. Causes: aqueous tear deficient dry eye. This occurs when lacrimal glands do not produce adequate volume of tears. And aging. Tear production naturally decreases as the people get older. And systemic and autoimmune diseases like Sjögren's syndrome, rheumatoid arthritis, lupus erythematosus, and thyroid diseases that will frequently attack the tear glands. Medication: certain drugs like diuretics, beta blockers, oral contraceptives, anticholinergics can reduce the tear secretion. Then scarring or damage conditions like Stevens-Johnson syndrome, trachoma, or radiation therapy can physically scar the tear ducts. Then other causes are evaporative dry eye, that is due to meibomian gland dysfunction and blepharitis, that is the blocked or inflamed oil glands in the eyelids fails to produce the necessary lipid or the oil layer of the tear film, allowing the tears to dry up quickly. Then environmental factors: dry, windy, dusty, or smoky environments, as well as prolonged exposure to air conditioning or heating. Then decreased blink rate, prolonged visual tasks such as extended screen use of computers, phones, or driving reduce the blink rate, accelerating the tear evaporation. And contact lenses: chronic contact lens wear can disrupt the normal tear film and worsen the evaporate dry. Structural or neurological causes like imperfect eyelid closure in case of facial nerve palsies or ductional lag of thalamus. It can cause the eye's surface to dry out. Then infrequent blinking. Neurological disorders such as Parkinson's disease limit the blink rate, leading to corneal exposure and dry. So here you can see the pathophysiology. There are so many things in the pathophysiology. Alteration in the conjunctival microbiome, tear film instability, that is the meibomian gland dysfunction, meibomian gland dysfunction. Ocular surface inflammation, ocular surface damage, tear film hyperosmolality, neurosensory abnormalities, brain dysfunction, altered gastrointestinal microbiome. These are all the pathophysiological changes what is occurring inside the eye. So clinical manifestations in this diagram we can see the watery eyes, the redness, swollen eyelids, and burning sensations. So comparison, you can see the picture, comparison of healthy and dry eye. So here you can see in the dry eye there is dry and irritated conjunctiva. So the symptoms are stinging or burning feeling, watery eyes or mucoid or mucopurulent discharge, red eyes, ocular discomfort, irritation and redness, visual changes, intermittent blurred or double vision, reflex tearing, and sensitivity to light or photophobia. Diagnostic investigations are: first one is ophthalmic examination, eye examination, then Schirmer tear test, fluorescein staining, and conjunctival cytology and culture. Diagnostic evaluations in detail. Ophthalmic examination, a visual inspection often reveals the physical examination reveals the redness or hyperemia, thick yellow or green mucoid discharge, and a dull, dry looking cornea. In chronic cases, the eye may develop dark pigmentation or new blood vessels, neovascularization. Then Schirmer tear test. This test involves placing a specialized strip of sterile filter paper inside the lower eyelid for 1 minute. Normal tear production is 15 mm or more. Values between 10 to 14 mm are considered suspect, and value less than 10 mm are diagnosis for KCS. And fluorescein staining, an orange dye is applied to the eye to check for secondary corneal ulcers, which are common in gaseous patients because a lack of tears leaves the surface vulnerable to damage. The dye will pool and glow bright green on damaged areas. And conjunctival cytology and culture. If a severe secondary infection is suspected, the veterinarian may collect cells or discharge to collect for excessive bacteria and type of inflammatory cells present. Complications. Corneal ulceration and perforations, neovascularization, filamentary keratitis, pannus formation, and keratinization. So corneal ulceration and perforation, neovascularization, new blood vessels, abnormal blood vessels may grow into the clear cornea to supply the nutrients, causing permanent opacity and unbearing vision. Pannus formation, abnormal fibrovascular layer can develop into the cornea, causing clouding and reducing the visual acuity. Filamentary keratitis, that is, the strands of mucus and dull cells can attach to the damaged corneal surface, causing severe irritation, foreign body sensation, and pain. Then keratinization, chronic severe dryness can cause the conjunctiva and comes to undergo metaplasia, meaning the delicate ocular surface tissue transforms into hardened skin-like tissue. Treatment, home management and lifestyle management, lubrication with artificial tears, eyelid hygiene, and by applying the warm compress. Environment, use a room humidifier, avoid a direct airflow from fans or air conditioners, and take conscious breaks to blink while working on screens. The medical management, anti-inflammatory drops, cyclosporin or lifitegrast, immunomodulators, the nasal sprays, certain nasal sprays like varenicline, autologous serum drops. If for severe refractory causes, eye drops created from the patient's own blood plasma can be used to promote corneal healing. Procedures and surgical care. Surgery is punctal occlusion. An ophthalmologist can insert tiny silicone or dissolvable plugs into your tear ducts or puncta to block the drainage, keeping your natural tears on the eye surface long. Then in office devices, that LipiFlow, that is vectored thermal pulsation and intense pulse light therapy, can be utilized to unblock the clogged meibomian glands and improve oil secretions. Then surgical options like minor surgical procedure is tarsorrhaphy, that is partially or fully sewing the eyelids together, may be performed to narrow the eye opening and reduce the tear evaporation. Nursing diagnosis, risk for dry eye, risk for corneal injury, impaired comfort or eye irritation related to dryness, itching, burning or foreign body sensation on the ocular surface. Deficient knowledge related to condition, its triggers and proper self-care. So the nursing goals, the patient will maintain a moist and intact corneal surface without signs of abrasion or infection. Patient will report a reduction in subjective eye discomfort, burning and irritation. The patient will successfully demonstrate proper eye hygiene, environmental adjustments and correct installation of eye drops. So next one is the nursing interventions, lubrication, then lubricating eye drops or nighttime ointments. Then environmental adjustment, advise the patient to avoid dry environments. Use humidifier to increase the indoor moisture. Then shield the eyes from air currents, ceiling fans or harsh winds. Education on blinking, instruct the patient to consciously blink more frequently, especially during extended visual tasks like reading or working on computers, laptops or smartphones to promote an even tear film. Then medicines, medications, antihistamines, diuretics and oral contraceptives. So assess the patient's current medications for drugs known as to decrease this tear production or exacerbate dryness. These drugs can exacerbate the dryness. So that should be reviewed. Then eye hygiene, eyelid hygiene to perform warm compress or commercial lid wipes to unclog the meibomian oil glands and soothe the eyes. Prevention of irritation by counsel the patient to avoid rubbing the eyes to prevent further irritation or corneal abrasion. Recommend wrapping protective sunglasses when outdoors. Ophthalmology referral. Refer the patient to an eye specialist if symptoms do not improve with conservative self-care or if they show the signs of severe ocular surface disease. Health education mainly about the conscious eye blinking, environmental control, lubrication of eye, use of artificial tears, eyelid hygiene, hydration and nutrition. So next topic is conjunctival bleeding, hemorrhage in the eye. A conjunctival hemorrhage or broken blood vessels occurs when a tiny conjunctival hemorrhage or broken blood vessel occurs when a tiny capillary under the clear membrane covering the eyes white break. It causes a bright red spot. Despite looking alarming, it is usually harmless, painless, does not affect and heals on its own within 1 or 2 weeks. So the common triggers are hard eye rubbing, straining or heavy lifting, coughing, sneezing or vomiting, minor eye traumas or contact lens use, medications like aspirin or blood thinners, example for it. So these are the details of causes. Straining and pressure, that is Valsalva maneuver, violent coughing or severe sneezing, vomiting or straining, heavy weight lifting or bending forward, physical exertion or the child labor. Underlying medical conditions like high blood pressure, hypertension, diabetes, blood clotting, if bleeding or bleeding disorders such as thrombocytopenia or liver diseases, conjunctival disorders, then trauma and mechanical irritation, aggressive eye rubbing, improper insertion, removal or extended wear of contact lenses, recent eye surgery, direct physical injury, blood thinning medications, regular use of aspirin, warfarin, clopidogrel or NSAIDs. Pathophysiology, let's see the pathophysiology, mechanical stress or these causative factors. Mechanical stress will lead to rupture of delicate conjunctival capillaries. And vascular fragility and systemic diseases will lead to hardened arteries that will weaken the blood vessels over time, making them highly susceptible to spontaneous rupture and will cause bleeding. Then infection and inflammation, acute hemorrhagic conjunctivitis or viral infections such as adenovirus or enterovirus or Coxsackie virus cause severe conjunctival inflammation which vasodilates and damages the local blood vessels which trigger the bleeding and causes conjunctival bleeding. Then clinical manifestations are visual appearance. You can see bright red, sometimes dark red patches on the sclera. Then sensations that will be patients may report. Sometimes it is completely painless. Sometimes there will be mild scratchy, dull or pulling sensation. Vision may be perfectly clear and unaffected. Color changes, as the blood reabsorbs, the spot changes color over time, mimicking a bruise, turning brown or yellowish before completely fading away. Then pain or swelling in the eyes, changes in your vision, blurriness or sensitivity to light. Bleeding occurs after significant eye trauma. You have multiple hemorrhages or recurrent. Then next is diagnostic investigations, medical history and physical examination. Rule out the serious trauma. Ensure there are foreign bodies. There are no foreign bodies, corneal abrasions or penetrating injuries. The medication review. What are the drugs they are taking, especially blood thinners that make bleeding more likely. Then systematic screening about the disease conditions, whether they are having any underlying conditions like high blood pressure or diabetes. Blood test to know about the bleeding and clotting disorders. So complications of conjunctival hemorrhage, trauma, systemic diseases, blood disorders, infection, corneal inflammation or permanent scar. Treatment, management and self-care. Do not rub your ears. Avoid certain medications. Avoid blood thinning agents, NSAIDs like aspirin and ibuprofen, or which can exacerbate the bleeding. Avoid, if you are taking prescribed anticoagulants, consult your doctors before stopping them. Limit the straining. Avoid heavy lifting, vigorous exercises, or severe coughing, as sudden BP spikes can worsen the hemorrhage. Contact lenses, remove the contact lenses until the hemorrhage has completely cleared. Nursing management, nursing diagnosis include impaired tissue integrity related to ruptured conjunctival blood vessels, deficient knowledge regarding the condition and expected recovery time, risk for injury related to visual disturbance or foreign body sensation. Nursing interventions, you can see, apply cold compress. That is, the rational cold constricts the blood vessels, helping to reduce any initial oozing or swelling and localized discomfort. Administer the lubricants. It soothes dry or scratchy sensation associated with conjunctival irritation. Avoid eye rubbing. Instruct the patient to strictly avoid rubbing or touching the eye. Rubbing can cause re-bleeding or introduce infection. Manage Valsalva maneuver. Advise the patient to avoid heavy lifting or straining during bowel movements and forceful coughing. These activities raise intraocular and venous pressure, which can exacerbate or prolong the bleeding. Health education, reassurance of the patient, medication review. Seek immediate medical care if the patient have any pain or vision changes or sensitivity to light, a blood covering the colored part or black part of your eye, that is iris or pupil, pus, thick discharge or swelling around the eye, frequent recurrent hemorrhages or unexplained bruising elsewhere on your body. So, concluding, we have seen the diseases of the conjunctiva, disorders of the conjunctiva, ranging from common benign inflammations like pink eye to vision threatening degenerative or autoimmune disease. Accurate early diagnosis is critical, as conditions like infections, allergies or growths require vastly different management strategies to prevent long-term ocular surface damage. So we have seen 3 disease conditions of or disorders of the conjunctiva. First one was conjunctivitis or pink eye. Second one was dry eye disease or keratoconjunctivitis SICCA, KCS. And third one was conjunctival hemorrhage. Thank you. Thank you so much.